Learn to Cope is a support organization that offers education, resources, and hope for parents and family members who have a loved one or a child who's suffering from substance abuse. It was founded in 2004 out of Raina, Massachusetts by Joanne Peterson, a mom who had an 18-year-old son who was suffering from an opiate addiction. Fast forward 10 years to today, her son's in long-term recovery. We now have 17 meeting chapters around the state and one in Worcester. We meet every Thursday evening at the Worcester Recovery Hospital from 7 to 8:30. If you come to one of our meetings, you're going to find support. Our meetings are ran by parents. We're not professionals. We are trained facilitators, and we have parents in our group that are all at different stages. For instance, we have parents that have children that are already in recovery, working sobriety. We have parents that have children that are going to treatment. They may be in and out of treatment. They could be relapsing, but their kids are working towards getting sober. And then we have the parents that walk into our meetings for the first time and they're in crisis. What's really good about going to a parent support group is that we've all been there. Sometimes when we go to our meetings on Thursdays, we see that parent out in the hallway just like pacing back and forth, worried about walking through that door. Are they going to see somebody that recognizes them? Are they going to be judged? But I have to tell you that we have like some of the best, most loving, supporting people. And in our Worcester group, we always have people that are willing to reach out and help everyone. And the other thing that's really great about our Worcester group is that once our members get stronger, they stay and they help us keep our meetings going. Without having the support of all our parents, we wouldn't be able to have such a great group. Our parents stay on and they help facilitate. They help us find speakers. What's really unique about our Learn to Cope meetings is that we have speakers come twice a month. The speakers could be someone that's already in long-term recovery, and they're working on just maintaining their sobriety. These speakers are really ideal to our parents because we can really relate to this young speaker and their journey. It gives us a chance to ask them those questions about why did you start using, where, when. And we always find out that it wasn't our fault the way that we parented our kids, because we all love our children. We want the best for them. They made a bad choice by experimenting, or maybe they became addicted by being overprescribed opiates from an injury or surgery. And that's one thing that we always want to stress to parents, that if you have a child that's going to be prescribed opiates from a doctor, talk to the doctor and find out if maybe you can go home with Tylenol first. Can you just get a few days of an opiate? If you do have to take a prescription home, lock it up. And any unused medication, take it back to the pharmacy and have it disposed of. We also invite treatment professionals and addiction specialists to come to our meetings and educate us about addiction. Addiction is a brain disease, and it's something that needs to be treated. A lot of times we feel like we're stigmatized, our children are, because our children are making bad choices. But once your brain becomes addicted, it's really hard. It takes a lot of treatment to change this different type of lifestyle that you've now taken on. We also offer overdose prevention. Learn to Cope is a state pilot program where we can train parents with Narcan. Narcan is the nasal overdose prevention spray. We've had among all our Learn to Cope pilot programs, we've had 35 parents that have saved lives. Parents could be first responders. In our case, in our Worcester group, one of our moms happened to have her Narcan on her, and there was a car that drove up with 3 young women in it, and one of the girls got out and started yelling that someone was overdosing in the car. She happened to have her Narcan and was able to reverse the overdose. They called 911 and the girl was saved. I've also was out in the community recently and I met a young woman who had 4 months of sobriety. And what got her into her treatment was she overdosed and was saved. What we highly recommend is that if you do have an opiate user in your family, come to our meetings and get your Narcan. It is free, it's confidential. If you don't have Narcan and you run across someone that's overdosing, do the rescue breathing, call 911. Any time that we can get oxygen back into someone's body, we can save their life and also prevent physical damage to their brain or bodies. Lastly, I'd like to say that as a parent, one of the things that we would really, really wish and hope for is that there would be like more education in our communities for our children and for parents. We feel that it's never too young to start educating your child about prescription and drug abuse. We'd like to see kids being educated about it in middle school. In our group, the average age of our kids are between 16 and 30 years old. Most of our kids started while they were in college. Some of them, like I mentioned, made a bad choice to experiment. Others became addicted by being overprescribed. A lot of them didn't even know that they had an addiction issue until they tried to stop using and went into withdrawals. So we feel that it's really important. We try to give all our parents hope because we've seen a lot of recovery out there. And by coming to our support group, you'll find out that you're no longer alone and that there is hope out there. Thank you. If you have any questions, please feel free.
So Terry, I'll ask you a question. So if I'm a parent and my son or daughter is actively using drugs and we tried to get him or her help and they've been in and out of treatment with the various treatment agencies, but they're relapsing, and I'm going through a lot of my own issues as a parent, obviously because of the number of issues we talk about, you know, the guilt, et cetera. So can I come to a Learn to Cope meeting and, I mean, there's no requirement outside of the fact that I am a parent who's having trouble with my son or daughter with substance use, abuse, or addiction.
Right. When you come to a Learn to Cope meeting, one of our main goals is to just provide support and education about addiction. And you do get that education by listening to professionals speak and also by hearing people that are in long-term recovery talk about their journeys. Also, being around parents that have walked this journey, you find out what's enabling behavior, what's good behavior, how you can help motivate to get your child into treatment. It is their choice. When you're dealing with adolescents, we really urge you to try to get them into treatment and have them stick with it. Once they reach the age of 18, it gets a little harder because they can make that choice. And sometimes as a parent, you have to have tough love in order to get them into treatment. And that could mean, if they're over the age of 18, is not allowing them to live in your house while they're using. But when they do go into treatment, you want to be there and be supportive and help them as much as you can.
Hi, Terry. Just a quick question. Do any of the recovering addicts, whether they be teenagers and or young adults, attend these support groups with their parents or not?
We have had some children that are suffering from addiction come with their parents. We usually ask that they only come when we have a speaker that's speaking about their own recovery, because if we're having like a regular support group meeting, a lot of times, you know, parents will, you know, they need to feel safe and comfortable talking about their own child's behavior. And I think sometimes if we see another child in there, we wouldn't want to like hurt their feelings or make them feel that you know, we're picking on them or anything, because what happens is when you do have a child that's suffering from addiction, there is a lot of negative behavior that goes around the disease. We do have siblings that come, and we really highly recommend that all family members come, because what happens is there is some resentment that starts to get built up around siblings, because the mom and dad now are so focused on trying to get help for their loved one that they totally start forgetting about the other family members.
So I noticed that you have a meeting list in the registration packet, and that the meetings are not only in Worcester, but they're in surrounding communities as well?
That's correct. We're in 17 communities, and we're forming more meetings. Sue Kokorian right here is our Central Mass Regional Manager, and she takes care of our Worcester, Framingham, and Gardner meetings.
And there's no cost to attend them?
Right, there's no cost to attend the meetings. They're free, they're confidential. Anyone's welcome to come. Also, I forgot to mention, we do have an online support group website as well. So if you're unable to attend a meeting, and there's an open discussion board on there that parents can use to continue to get support.